Lung cancer is a type of cancer that begins in the lungs, typically in the cells lining the airways. It is one of the most common and deadliest cancers worldwide. There are two main types of lung cancer: non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC. These types differ in their behavior, prognosis, and treatment approaches. Types of lung cancer: non-small cell lung cancer, NSCLC adenocarcinoma. The most common type, often found in the outer parts of the lungs. It is more common in non-smokers and in women. Squamous cell carcinoma typically arises in the central part of the lungs, often linked to smoking. Large cell carcinoma, a less common and more aggressive form of NSCLC that can appear in any part of the lung. Small cell lung cancer, SCLC, a rarer but more aggressive type of lung cancer. It tends to grow and spread quickly. SCLC is almost always associated with smoking and is often diagnosed at a later stage. Causes and risk factors. The primary cause of lung cancer is cigarette smoking, which accounts for the majority of cases. Other risk factors include secondhand smoke, exposure to tobacco smoke from others, radon gas, a naturally occurring radioactive gas that can accumulate in homes, asbestos exposure. Occupational exposure to asbestos increases the risk of lung cancer. Air pollution, prolonged exposure to polluted air can contribute to lung cancer risk. Genetic factors. Family history of lung cancer or inherited genetic mutations may increase risk. Previous lung disease conditions, like chronic obstructive pulmonary disease, COPD, or pulmonary fibrosis. Symptoms. Lung cancer symptoms often do not appear until the disease has progressed. Common signs include persistent cough that doesn't go away, chest pain or discomfort, shortness of breath or wheezing, coughing up blood, hemoptysis, fatigue or weakness, weight loss and loss of appetite, hoarseness or change in voice, recurrent respiratory infections, e.g., pneumonia or bronchitis. Diagnosis. Diagnosis is typically made through a combination of imaging tests, biopsies, and other procedures. 1. Chest X-ray, a common initial imaging test to look for abnormalities. 2. CT scan, computed tomography, provides detailed images of the lungs to help locate tumors. 3. Bronchoscopy, a procedure where a thin tube is inserted into the airways to look for abnormal tissue and collect a biopsy sample. 4. Biopsy. Tissue is removed from the tumor and examined under a microscope for cancer cells. 5. PET scan, positron emission tomography, helps to determine if the cancer has spread. 6. Molecular testing identifies genetic mutations in cancer cells that may guide targeted therapy. Staging of lung cancer. Staging refers to how far the cancer has spread and is critical for determining treatment options. It is usually done using the TNM system, where T refers to the size and location of the primary tumor. N describes the extent of lymph node involvement. M indicates whether the cancer has metastasized, spread to other organs. Staging ranges from stage Y, localized, to stage IV, advanced, metastatic. Treatment options. Treatment depends on the type, stage, and location of lung cancer, as well as the patient's overall health. Common treatment options include 1. Surgery, lobectomy, removal of a lobe of the lung. Pneumonectomy, removal of an entire lung. Segmentectomy or wedge resection, removal of a small part of the lung. Surgery is usually recommended for early-stage NSCLC. 2. Radiation therapy. High-energy radiation is used to target cancer cells. It may be used for inoperable tumors, to shrink tumors before surgery, or to treat metastatic cancer. 3. Chemotherapy involves the use of drugs to kill or stop the growth of cancer cells. It is often used in advanced stage or metastatic lung cancer and sometimes after surgery to reduce recurrence risk. 4. Targeted therapy. This treatment focuses on specific genetic mutations that drive cancer growth. Drugs such as EGFR inhibitors, e.g. erlotinib, gefitinib, or ALK inhibitors, e.g. crizotinib, can target these mutations, especially in non-small cell lung cancer. 5. Immunotherapy involves the use of drugs to help the body's immune system recognize and attack cancer cells. Drugs like checkpoint inhibitors, e.g. nivolumab, pembrolizumab, are commonly used for advanced stage cancers. 6. Palliative care focuses on relieving symptoms and improving the quality of life, especially in advanced or terminal stages of lung cancer. It can involve pain management, oxygen therapy, and support for breathing problems. Prognosis. The prognosis for lung cancer depends on several factors, including the type of lung cancer, stage at diagnosis, the patient's overall health, and response to treatment. Early-stage lung cancer has a better prognosis, while advanced-stage cancer may be more difficult to treat. The 5-year survival rate for lung cancer varies. Non-small cell lung cancer, NSCLC. The overall 5-year survival rate is around 24%. Early-stage survival rates are much higher. Small cell lung cancer, SCLC. The 5-year survival rate is much lower, around 7%, as it tends to spread rapidly. Prevention. While not all cases of lung cancer can be prevented, certain steps can reduce the risk. Quit smoking. The single most important step to reduce lung cancer risk. Avoid secondhand smoke. Stay away from areas with tobacco smoke. Limit exposure to radon. Use a radon detection kit in the home. Avoid exposure to carcinogens such as asbestos and certain chemicals in the workplace. Lung cancer is a major public health concern with a high mortality rate. Early detection through regular screening, especially for high-risk individuals, and advances in treatment like targeted therapies and immunotherapies have improved outcomes. However, prevention remains the most effective strategy, particularly reducing tobacco use and environmental exposures.